My name is Andrew Knight, and I teach music therapy here at University of North Dakota. I'll be taking you through the Teamwork and Communication with Team STEPPS presentation, which is adapted from Dr. Brian Ross at the University of Washington. This presentation is part of something that we're bringing to the program as part of a Macy Foundation grant. The Josiah Macy Foundation has been involved with improving interprofessional education, specifically in terms of faculty development, for several years now, and a couple members of the course, myself included, have actually been at University of Washington and University of Missouri, two of the different schools involved here as primary investigators to this grant project, so that we're better understanding interprofessional learning and interprofessional education. So we hope to bring a couple very important things to this program, and we want you to know that you're part of a very select group of universities that are essentially leading the nation in terms of interprofessional education and how we're putting this course together. The idea of interprofessional healthcare is a little bit newer in the United States than it is in other places. We also have this idea of uniprofessional, the top part of the slide, that physicians would make house calls. The physician shows up to the house, assesses the patient, diagnoses treatment, treats the patient, dispenses pharmaceuticals maybe, evaluates how well they're doing, and that whole notion of take 2 of these and call me in the morning. But then as other professions began to crop up with more specialties, for instance, occupational therapy and physical therapy, and became more prevalent, we went to a multi-professional system where there's lots of different professions working separately to help a patient out. What we'd like to get to is interprofessional, but also transprofessional. Interprofessional is the idea that all professions are working with each other with the patient at the center of the care, which is a little bit different than multi-professional, where professions are working by themselves, but still with the patient as the center. Transprofessional is the idea that we all have overlapping scopes of practice and that we can all do different things dictated by our own professions, discipline-specific, you might say, but that transprofessional shows how, because of our overlapping scopes of practice, how we're best able to work together in the efforts of the patient. So there's 4 different areas for good patient care that you need to develop this shared mental model. In the picture, there's not much sharing of the mental model here. A mental model could be as simple as the idea that this is a toxic environment, and 4 people in this picture understand about this toxicity, and then one person does not believe that this is a toxic environment. He does not share their mental model. For everybody to be on the same page, we've got these 4 different areas. First one I'll start with is leadership or teammanship. And these 4 different team steps communication tools are briefs, huddles, debriefs, and handoffs. Briefs are what happens when somebody needs a little bit of information and wants to make sure the team is in on it. So you huddle together and you try to solve a problem. The debrief happens after, so you decide, did we do a good job assessing this particular issue? And you're evaluating it for process improvement. Can we do it better in the future? A handoff or a transfer of care is a very important communication aspect that goes a long way, especially as well in terms of reducing medical errors. A handoff might be a transfer of care from an emergency room to an ICU, or from a rehab unit back discharged to a nursing home, for instance. Communication is of utmost importance at this time, so briefing, huddling, debriefing could all be part of those different bits of transfer of care, so handoffs are very important. Anyone at any time can request a brief, huddle, or debrief, so immediately, hopefully, you see that these disciplines, everybody's on the same playing field. It's a level playing field. Anybody can request these things at any time. The second aspect is communication. And for communication to be effective, it must be complete, clear, concise. Those are the 3 C's really to remember. One way to do this is SBAR, Situation, Background, Assessment, and Recommendation. So there's 4 tools on the communication side of things. We'll start with SBAR. Nursing students are probably more familiar with SBAR than some of the other professions involved. SBAR is a framework for team members to effectively communicate information to each other. You give the situation, what's happening with the patient, what's the background or clinical context, what do I think the problem is, or what's my personal assessment, and then what's my recommendation of the case. So you can see why nursing might have a better idea what this is, because nurses might have to call a physician up and say, here's what's happening with patient X. His or her clinical background is Y. Here's what I think is going on. Here's what I would do about it. Here's my recommendation to you. Let me know if you agree with it. That's an example of SBAR. A call out is one level of communication. A team member can either alert others that they're arriving, anesthesia's here, in a surgical environment, for instance, or the letter B here, a request for data or information in response to the request. What's the airway status? The airway is clear. Breath sounds, as in, are there breath sounds right now? And breath sounds are decreased on the right. Call-out example is a tactic used to communicate or share information with the whole team, often directed at a specific individual, often the team leader, and it's frequently unrequested information. So the call-out is the first level of that, a request for data. The cross-check, and the parrot here is meant to help you understand the cross-check, is about parroting back the information. It's a closed-loop communication strategy that's used to verify a request is received. The sender initiates a request or a message, and the receiver confirms he or she has received the request. The checkback is really the third level. The checkback includes a call-out saying, this is what's happening, or, for instance, call anesthesia. There's a cross-check involved that says, I'm calling for anesthesia. The checkback says, and now I have done that. I have contacted anesthesia. The Starbucks cups on there, the checkback is to help you remember that the checkback is really something that's part of this closed loop cycle. You'd see it in any Starbucks, Burger King, McDonald's, any sort of drive-through. You get an order, it somehow gets relayed to another team member. They have to confirm that they heard that. They'll yell it back to somebody else, and then while they're handing the venti latte to you, or whatever it is that you ordered, they're saying, and here's what you ordered. You ordered the venti latte, and they're closing that communication loop, and that's a check back. Mutual support, the third area, has two different areas, or two different communication techniques. One of them is the two-challenge rule, and the other one is called CUSS, but not C-U-S-S like swearing. C-U-S is an acronym. We'll get to that in a second. The two-challenge rule is the idea that any member of the team should feel free to challenge a decision made by the team twice. Bring something up, say, this is something that I'm not quite clear about. I don't believe this is the right path. If there's no clear discussion on it, or the conflict hasn't been resolved, then a second challenge is in order, and a two-challenge rule should be encouraged by leaders in a hospital setting as well. CUS, the CUS, is I need clarification, I am uncomfortable, and this is a safety issue. If you can remember those three letters and the way to ask for something, think about it in a discharge meeting, for instance. At this point, Miss So-and-so is being scheduled to go home. Maybe you, as the occupational therapist, said, hold on, I need clarification here. Is it our assumption as the discharge team here that Miss So-and-so has accomplished X, Y, and Z? Because I'm uncomfortable with this decision. I believe this is threatening to her safety. In my sessions, in my OT sessions with Miss So-and-so, here's what I've been seeing. Different ways to lay out these three aspects, CUS. The last issue, situational monitoring awareness, includes a couple of more broad techniques for team STEPPS, communication techniques. Situational monitoring is a process of actively scanning behaviors and actions of other team members to assess elements of the situation environment. It helps you understand how the team member is focused globally. Any member of the team at any time should be cross-monitoring, the idea that we're all doing a real-time assessment of the particular medical situation at any point in time. It provides a safety net for the team and the patient because everyone is constantly checking each other, but in a respectful, situational manner. The idea that we're all working together in the same moment, on the same person, towards the same goal. Situational monitoring more broadly helps us understand how to do that. So final steps, things to do for next week. You can review the Team STEPPS Pocket Guide, which is also has a smartphone app. You can go to the Team STEPPS website. If you haven't gotten a Pocket Guide, you can request one for yourself. You can request it for the rest of your course mates if you want. They're free. Team STEPPS with 2 Ps.ahrq.gov.gov. And look at the rest of the website to see what they have to say about Team STEPPS. Come prepared to share what the current literature says about Team STEPPS and discuss the strategies presented like CUS, SBAR, callouts, checkbacks, checks, cross checks, and those sorts of things. That's your assignment for week 2. Hope you enjoyed the presentation and hope you enjoy interprofessional healthcare. My name is Andrew Knight from UND Music Therapy.